Money FM 89.3, the best of the afternoon update.
Now, as people become more aware of the importance of staying healthy and the rising costs of healthcare, there is a growing focus on preventive care and personalised medicine. So today we're going to be talking about the private healthcare and wellness industry. How is private healthcare in Singapore adapting to technological advancements, changing consumer demands, and an ageing population? What role do AI, telemedicine, and holistic wellness play in transforming patient care? And how can Singapore maintain its position as a leading hub for premium healthcare services in the region? Well, my guests today are three lovely healthcare practitioners who are not only helping corporate firms build a healthy and engaged workforce, but also supporting other healthcare providers to grow their practices sustainably. Let me introduce to you the trio we have in the studio today. They are Aileen Seah.
Hello, nice to meet you.
Amelia Lee.
Hi, nice to meet you.
And Goh Xin Ying, co-founders and managing directors of the Health Collective. Ladies, welcome to the Money FM 89.3 studio. Wonderful to have you all here.
Thank you for having us.
Thank you.
Now, before we delve into industry trends and innovations in healthcare, could you tell me a little more about the Health Collective? I think I read somewhere that it consists of a chiropractic chain, a dental chain, and an osteopathy and physiotherapy chain. Is that right?
Yep, absolutely. So just to share some background about us, back in 2018, we actually left our corporate jobs and wanted to find a business that had impact. So that's why we came into, doing this. So 2019 was when we first acquired our first chiropractic clinic, which is under the brand Chiropractic Singapore. And then 2021 is when we also acquired the City Osteopathy and Physiotherapy, as well as We Smile Dental. And, as three female founders, we are acutely aware of the struggles that females feel when it comes to just taking care of your health. You have family commitments, you have work, and it's just very hard for us to prioritize our own health. And that's why we are really doing what we do at the Health Collective to be an advocate for proactive, preventative health. And I don't think that has enough coverage or mind space of women today. And that's what we're really trying to promote.
I see. So you're all business trained. Aileen and Xin here at SMU, and Amelia, you have an MBA from Harvard Business School. Did Singapore's healthcare landscape have any influence on, your decision to go into the business of healthcare?
I think for us, looking to our parents' generation, they are still very reactive when it comes to their health. So when they feel pain, when they feel symptoms, that's when you go see the doctor, that's when you go see your physio. But we do realize that, people in our generation, the 30s, 40s, 50s, we're getting more aware about taking care of our health earlier on. And that's why we thought, this is an interesting space to go into, really being more wellness-oriented rather than symptomatic and reactive about healthcare.
Can you talk more about that?
I think generally in Singapore, a lot of us are very stressed, right? The whole environment, everyone is very stressed at work, caregiving responsibilities, etc. So a lot of times there may be symptoms that your body has kind of like showed you. For example, you might have like a loss of balance or back pain, neck pain, but we just kind of push through these discomfort. We just ignore them. So I think this is what we are trying to do, like to kind of get everyone on board, don't ignore these symptoms, actually go and seek some help, change your diet, for example, anything that could help you prevent yourself from having long-term chronic pain in the future.
Okay. Amelia, you collectively run 13 clinics. So what are some of the trends and innovation that you're seeing in this industry?
Yeah, I think over the past couple of years, we definitely see that, people have been picking up a lot more use of technology. And I mean, we're not talking of course, there's always big data, AI and all that good stuff. But honestly, in the private space, I think even when we first took over the businesses, it's kind of moving from being on-premise to things, going a bit digital. And I think that's where we really feel that we can value add, because as we move a lot of these physical clinics into the digital realm, it helps us to make a lot more decisions better, because we have much better data where our patients are coming from, and subsequently that helps us better serve our community and the population that we're trying to reach out, really.
Okay. And, when I go to your website, it says that you're helping corporate firms build healthy and engaged workforces. You're also supporting other healthcare providers to grow their practices sustainably.
Yeah.
How do you do that? Tell me more.
So actually, we have been very active in going to corporate. So in the last, I would say 2-3 years, we've built a network of over 190 corporates that we go in and do health screenings, because we know nobody has the time to go see a doctor or see a physio, see a chiropractor. So what we do is we bring the convenience to your office. So during lunch or maybe during tea break, you can come down, get a free screening done. So at least you know whether you are more prone to potentially any further illnesses or disease down the road. So that's what we're really big on doing when we work with corporates. On the other hand, the work with our other healthcare providers is something that we've just started this year.
I see.
And we are really trying to bring all the expertise we've done, because a lot of the clinics you see out there are typically owned by practitioners, owned by doctors who are trained in medicine, and they are fantastic at what they do for patient care. Unfortunately, that's where we find there's a bit of lack in terms of how do you converse or really convert what you're trying to say to the patient to a layman.
I see.
So telling them, not just like, for example, if you're setting aesthetic treatment, what is this machine so great about? But more like, these are the symptoms that, you could be concerned about, and don't ignore them. So really translating medical speak into layman so that it's easier. So that's the bridge that we get, because we have been working with practitioners for so long, and we are business trained, so we know how to bridge that gap.
Okay. Are you also introducing perhaps technology into this business? Telemedicine, digital health, as Amelia mentioned, AI and data stuff as well?
Yeah, absolutely. So one of the things that I think we're quite proud of ourselves is that we really track everything across our 13 clinics to a T. So I can tell you, as of yesterday, how many patients we've seen, how many patients have come in for what illness, what symptom, things like that. And that's something that I think for multi-clinic practitioners or practices, they might not have that visibility. So that's the kind of systems that we want to help other healthcare practitioners. So when you see an increasing trend for people who come in for maybe back pain, neck pain, or maybe pelvic health issues. So then you can tailor your treatments better, things like that. So that's something that we are working to see how we can spread that to more healthcare practitioners.
Okay, so coming back to preventive healthcare, what are you seeing? What are the demographics? Are the patients younger, or, who are the ones who are more concerned about preventing diseases, I suppose?
I would say, in terms of the trend, there might be a very slight increase of people who focus on preventative healthcare, but I think it's not enough. Yeah, maybe we could argue that the younger generations nowadays have more content online. They actually know, they read more, and they actually engage in more preventative healthcare. But honestly, they're not the ones that are feeling pain nowadays as well, so they may not act upon it.
Okay.
So
yeah, I think it's a bit cultural. The nuance is really across various cultures. I think, as broadly speaking, as an Asian population, we're still quite symptomatic. We have a lot of our clinicians who are also expats, and with them, the expat population also comes to see them in our clinics. Some of our clinics, we serve a good half of our patients could be expats, and I think the mindset is quite different. Often, you think I go to a physio because I broke my leg while playing something, right? But a lot of expats, I think, have kind of the preventative mindset, I want to train, I want to do better, and then hence I should go and see a physio to make sure that my form is right, I'm doing the right things so that I can perform even better in the sport that I'm playing in, even recreationally.
Okay. Yeah. And I understand that you started this in 2019.
Yep.
That was when COVID hit.
Yes.
So how has consumer behavior changed, in private healthcare post-pandemic?
So I think COVID was actually a very good period and a wake-up call for a lot of Singaporeans, I think. So what we've realized is that a lot of people don't take small matters too lightly nowadays. So you can see that trend quite obviously. So previously, when the patients came in and we were doing the consult, our doctors would tell us, and like what Amelia said, right, all of them are expats, and they don't understand why Singaporeans like to normalize pain. They'll say, I have some small neck ache. It only comes and goes. It's okay. Don't worry about it. But that's your body's way of telling you something is wrong.
That's
So
right.
they're just baffled as to why are we like that. But after COVID, we did see more people saying, oh, I have this nagging pain. It comes now and then. But they're more serious about it. So I think that's a good trend that we are quite heartened to see. But adding on to what Xin Ying said, really not enough. Still very reactive and symptomatic still.
Okay. I'd like to find out more about the practitioners' part of things. What are some of the challenges that they face in private healthcare?
I guess going back to your question of COVID also, right? Like, scheduling is always a thing. Only through COVID did we realize that the nice thing about working from home is that, you can kind of have a bit more flexibility around your time. Now that we're moving back to the office, our weekend slots always long wait list, the middle of the day on like a Wednesday or a Thursday, maybe not so much. So I think just kind of, while Singapore, arguably a small place, right? Like theoretically going for fulfilling a appointment maybe that's 20 minutes away shouldn't be that difficult, but as we move back to return to office, that's kind of just the scheduling challenges that we've been seeing a bit more, I think. Yeah.
Okay. And in terms of balancing business and patient care, top-notch patient care, which is what people go to private healthcare for, primary reason why they do that. How do you ensure quality while staying profitable?
So at our clinics, we actually have ongoing trainings that we have for our practitioners. And to be honest, a lot of practitioners love working with us because they don't need to care a lot about the admin part of things, to whether they're paying the rent or hiring receptionists. So they actually would like to focus on patient care. And what we do is we actually organize quarterly CPDs, for example. We have training across our brands so that our practitioners are kept on top of the current kind of symptoms, and they also share their expertise across the different brands. That's one.
Yeah, I mean, for us, any practitioner that comes on board with us, our golden rule is be authentic and be sincere. Our number one top value is treat the patient like your mom. So a lot of times what we realize is that sometimes our practitioners, especially in private healthcare, people are a bit more cognizant of costs. Like what you say, rising healthcare costs, right?
That's right.
So we tell them, don't impose your own financial values on the patient. So if it's your mom, you wouldn't say, I would recommend this, but I think it might be a bit too expensive for you. So don't impose that kind of financial values. Just recommend the treatment, which is what the patient needs. And I always say the patients can feel your authenticity and your sincerity, and that's what will make them come back. So don't worry too much about I need to earn XXX dollars. That's not our focus. Our focus is really delivering the right quality care for the patients. The rest, leave it up to us.
Wonderful.
Yeah.
Ladies, we are marking International Women's Day on the 8th of March. And here we are, 4 women talking about healthcare and well-being. So what advice would you give to women who are perhaps looking to start their own private healthcare practice?
Well, firstly, you can always come and work with us. A little advertisement for ourselves. We promise that we'll help you take care of all the things that are annoying and painful for you so that you can authentically be your best healthcare provider. But yeah, really, I think women don't give ourselves enough credit. It's just kind of go out there. If you want to do your own thing, just take the first step forward. And if you ever need our numbers and you find that you're struggling, you can know where to find us.
Yeah, I just do it. Yeah.
I think we're always very ready to help anybody out there, whether it's to start our own practice or any ideas in terms of where to do it, how to do it, how are you doing it. It's difficult, especially if you would like to balance between your work and family.
That's right.
Both of them just had 3 kids each.
Wow.
So it's
Young mothers.
So it's tough. We really understand it. So come to us and
Okay.
we are happy to help.
Very quickly, ladies, for those who may not be looking into becoming, an entrepreneur, what do you think women should do to take better care of their health and well-being?
Yeah, I think what Aileen had said earlier about symptoms being common but not necessarily normal is the first thing that we kind of all need to ingrain in our heads. After having 3 kids each, right? My mom also had 3 kids. She was like, it's perfectly normal to be leaking pee, for instance, but just because it's common doesn't mean it's normal. So I think just ingraining and getting yourself over that hurdle that common is not necessarily acceptable is something that I think the best thing you could do for yourself.
Yeah,
Aileen?
agreed. I mean, we always say common is not normal, and people need to stop thinking that pain and symptoms are just fine. Like what she said, urinary incontinence and poor pelvic health is something that we are honestly quite passionate about, because after giving birth to 3 kids, yeah, you
Your
can
pelvic
imagine.
floor is
You
in
can
shambles.
imagine.
I know what you mean. I've got 2 kids myself.
Oh, yes. So it's something that we really want to change mindset, and mindset change is tough. Yeah. So I think just getting women to think about that. would be
Just
great.
shifting from reactive healthcare to proactive healthcare is what we want the community to start thinking about.
All right. And
Yeah.
with that, thank you so much, ladies,
Thank
for
you.
coming to the studio and talking to us about private healthcare and wellness, this industry, as well as some useful tips. Aileen Seah, Amelia Lee, and Goh Xin Ying, co-founders and managing directors of the Health Collective, which is a private healthcare and wellness, as well as solutions provider in Singapore. Thank you, ladies.
Thank you.
Thank you.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.